I would just like to welcome everyone to this webinar for Advocates for Ohio's Future. We're going to be talking about Medicaid work requirement proposals today. I'm Danny Carlson. I'm the Communications Director for the Center for Community Solutions. And today we have some excellent speakers who are going to be presenting about this topic, starting with my colleague Loren Anthis, who is a Public Policy Fellow at the Center for Medicaid Policy at the Center for Community Solutions. Kate McGarvey will also be joining us. She is the Director of the Legal Aid Society of Columbus, and Steve Wagner, the Executive Director of Universal Healthcare Action Network of Ohio. To kick things off, I'm going to toss things to my colleague, Loren Anthis, who is going to kick off this webinar for us.
Thank you, Danny. So I'll just touch a little bit on the work requirements as the state has put forward in terms of their proposal. First, I want to start with some of the context here. You'll see a picture of Administrator Seema Verma from the Centers for Medicare and Medicaid Services. For those of you who may be familiar, she was the architect of Indiana and Kentucky's waivers around cost sharing, and in fact played a large role in Ohio's initial Healthy Ohio waiver, which was established cost sharing as well, that ultimately failed on the federal level. But now she is leading CMS and has obviously a different orientation than the Obama administration leadership in terms of what Medicaid is and how it's supposed to be implemented. And in many ways, sees 1115 waivers and other activities of the federal government as and her, the rulemaking authority, et cetera, sub-regulatory guidance, et cetera, as ways to sort of reform the program without overt action from Congress. And I wanted to pull out this quote in particular, where it kind of highlights the reasoning for these policies. She says that believing that community engagement requirements, otherwise known as work requirements, do not support the objectives of Medicaid is a tragic example of the soft bigotry of low expectations consistently espoused by the prior administration. The idea here is that work or being an active participant in the community, however it gets defined through these efforts, is a key component of the Medicaid program in terms of its overall goals. This is going to be the basis of some of the legal questions that we'll talk about, and also the purpose of these sorts of waivers. So looking at the work requirements and how they are constructed, first I want to highlight state law. So this is something that the General Assembly of Ohio has mandated of the Medicaid Director. It specifically says that the Medicaid Director shall establish a Medicaid waiver component under which the expansion group must be included and meet one of the following conditions: that they are at least 55 years of age, they're employed, they're enrolled in school or some sort of training program, that they are participating in treatment for SUD, substance use disorder, or some other sort of addiction treatment, or have an intensive physical health care need or serious mental illness. The state's proposal tries to adopt some of this and also tries to integrate some of the guidance from the Centers for Medicare and Medicaid Services and makes a few different distinctions. Number one, that where the state identified 55, they're aligning it around 50 years of age. They also, how they term it, is the physical or mental unfitness for employment. They're a participant in the SRS program, they're pregnant, maybe they're in school at least half-time, et cetera. And then they also try to align it with the Supplemental Nutrition Assistance Program's ABOD requirements, so work requirements for food stamps for able-bodied adults without dependents. And then there's additional exemptions for counties with high unemployment rates, so similar to what you see in the ABOD program. And that if this status changes, that if an individual who is exempt or might be meeting a requirement or may not be but needs something to change, that they have 10 days basically to let the state know that their status has changed. First, we have to understand work requirements generally now and who this affects. The state has been very effective in messaging that this, quote, affects only 1 in 20 Medicaid expansion enrollees. The reality is it affects all 20. The question is, what happens if you are one of those 20, and under what conditions do you qualify for an exemption, or under what conditions are you meeting the requirement? This is data from the Kaiser Family Foundation, which shows about 60% of folks are working full-time or part-time. That's consistent with the state's information. And oftentimes people are either sick or taking care of a family member, going to school, et cetera. So while the state is trying to make accommodations for the conditions of individuals who are a part of this group and thus would be subject to the requirement, those accommodations still represent an additional layer of governmental process of eligibility determination that previously did not exist. So in terms of work requirements and some of the components to this, first of all, there's a process of self-attestation, this idea that individuals basically say, yes, I believe I am exempt, or I'm meeting the following requirements. That requires some level of signed documentation. I think that there's more detail needed here about what that includes or what that does not include, and also liability associated with attesting to something that may or may not be true or that is conditional. There's another layer, too, with appraisals. So county departments of Job and Family Services can appraise individuals to see whether or not they meet these exemptions. Now, the state in its proposal has said that this will likely not require face-to-face engagement. I would say that may be true in some circumstances, but in all likelihood would likely require some level of in-person interaction. This is coming from some of the conversations I've had with county departments who say, you know, the way that things are in the current system and how we have to case manage these things, it's unlikely that this will be an easy telephonic-based or even just digital process solely. It's going to require some level of engagement beyond that. And even then, there's still costs associated with that. Speaking of the digital process, the Ohio Integrated Eligibility System is still being propped up. So in the Office of Health Transformation's summary information, they say that at some point in the future, OIS will have all this information about whether or not someone's a part of the ABOD group, or if they're a parent or caretaker, or if they have a major chronic disease. But that is not the current state of affairs. And even in their estimates, they were relying on July 2017 data. So the question is, once this does become rolled out, how do they manage that? Is that going to be a manual process for a certain time? How will this reconcile with the OIS implementation, which has been delayed to July? So are we propping up these systems at the same time? What data can county departments see versus what they cannot see? And is this something that the state will direct and centralize? So will they just submit information to county departments and say, here's your list of folks that you have to reach out with? There's also questions around other documentation. So we talk about medical unfitness, whether someone's physically or mentally unable. That would likely require some level of review by a licensed professional to sign off on documentation saying that they are medically unfit, and then that documentation would have to be provided to the county department. So first question, if you're not eligible first, how do you get an appointment in the first place? Being someone who's worked in the provider community, you know, there are questions about training, financial staff, providers, legal departments, et cetera, about doctors filling out forms to this effect, because this is a new requirement. This is a brand new sort of level of paperwork. And two, what are the liability considerations there? So where you know, the state might be very accurate in its statement that in the perfect system, only 18,000 of the 700,000 people who are part of the expansion get affected. The question is, how do all 20 get there? And regardless of where it might be in the future in terms of the ease of use, let's say, it's still very different than what exists today, because today we're talking about income, we're talking about age. In the future, there are many more conditions that people have to satisfy or prove or document based on which county they live in. There might be different processes associated and providers who are mitigating factors in all of this. So there's additional layer process, and with that complexity, we imagine greater cost. We imagine that the disenrollment will be higher. So some key policy considerations in all of this. Number one, that the per member per month of the expansion population in the state's estimates is increased. So this probably means that the healthier folks who are part of the expansion are dropping off. There's also a question as to how that affects other parts of state law that says that the Medicaid director has to pursue policies which lower the average cost for the entire population, as the Joint Medicaid Oversight Committee has noted with their independent actuary. the Medicaid expansion has a deflationary impact on the average cost of Medicaid overall. So by losing some of the healthier folks, you might actually be increasing these average costs. The estimates on disenrollment seem low to me. I think that's only because, as this webinar has showed us, technology doesn't always work very smoothly. The estimates on costs also don't capture administration. They really seem to only talk about the $571 million over 5 years that gets saved from lack of enrollment. I would like to point out, too, that enrollment, or that number, rather, in terms of cost savings, is only less than 0.5% of the total amount spent in the program, so it's really not that much in totality. And it's interesting to note that they did not include how this might affect the cost of local governments, CDs, JFS, who have to reconcile case management with the realities of this. How does this affect things like collective bargaining agreements, et cetera? There's greater questions as to the legality, and I think Kate will touch on that. There's also a racial equity issue. Our director, John Corlett, will be offering something soon. This exemption for counties is largely rural, but many of the unemployment realities of counties are similar in cities. So, there's more in common between places like Hardin County and the city of Cleveland than there aren't in regards to unemployment. But the major difference here is the application of law in terms of its demographic impact. So there are questions as to whether or not this disproportionately harms African American populations who are a part of the expansion. There's additional questions about what happens if the benefits are inappropriately applied. Who's liable? So let's say that someone receives services, but they were technically ineligible. How does the federal government go about recouping those funds? Usually it comes from providers. So providers might be at risk for this, and individuals additionally may be at risk because if providers try to recoup that expense, they may either cost shift and increase their cost or price to private insurers, or they might send more people into collections. There was a hearing on the 21st, but there's an additional hearing this Thursday in Columbus at the Medical Care Advisory Committee in the Lazarus Building at 10 a.m. Folks are welcome to provide that testimony 2 to 3 minutes in person. They're saying the comment period closes on the 18th. However, I imagine that they will submit this to CMS much later than the 18th because there's a federal requirement that the submission of the proposal has to take place in no less than 20 days after the last public hearing. So the public hearing being on the 1st, the earliest they could submit is the 21st. I imagine that it's probably going to be sometime after that, with, I believe, the state saying that they're looking at April. Obviously, if there are any questions about this, thoughts or considerations, always feel free to reach out to me. You can see my contact information here. That being said, I'm going to hand it over to Kate to talk a little bit more about some of the legal implications of this proposal.
Thanks, Loren. Well, I wanted to start off with talking a little bit about the Dear State Medicaid Director letter that came out in January. And so Loren referenced this somewhat. I don't know if we can skip the slide forward. Another one? There we go. All right. So this was a new policy laid out by the Center for Medicare and Medicaid Services, where they are saying that this design is to assist states in their efforts to improve Medicaid enrollee health and well-being through incentivizing work and community engagement among non-elderly, non-pregnant adult Medicaid beneficiaries who are also not disabled. The letter really sort of turns the research on its head regarding the fact that they say how the research shows that unemployed Americans are more likely to have depression, health care, and therefore that you should require work, as opposed to the flip side, we're seeing health care as a support which enables you to work. CMS lists community engagement activities, skills training, education, job search, caregiving, and volunteer service as things that they would consider examples within this this new policy. They say that they recognize that this is a shift from prior agency policy, but then they claim that it's anchored in historic CMS principles that emphasize work to promote health and well-being. It's not clear where they are getting those historic principles from, but that's what the Dear State Medicaid Director letter says. They talk about allowing state flexibility in the program design. They highlight alignment with other programs. So as Loren was talking about, they talk about aligning SNAP and TANF with the Medicaid work requirement, and certainly that's what we've seen Ohio try to do. They discuss clearly identifying who is subject to the work requirements, a little discussion about reasonable accommodations, and then also specifically mention individuals who are in treatment for substance abuse disorders. The last thing I'll note from this letter is that they mention beneficiary supports, and they say that states should think about this, but that they will not authorize Medicaid funding to finance these services. And I think that's crucial because as Ohio has laid out their waiver, they talk about the importance of having the availability of those additional supportive services, which are not currently available, at least according to the CMS guidance letter. So Loren asked, is it legal? And I think that is an excellent question. The first test of that we have is with Kentucky Health. That is Kentucky's waiver. And so Kentucky's waiver was pending for a long time. It was approved the day after the CMS Dear State Medicaid letter came out. The Kentucky waiver has many different parts. So as opposed to Ohio's waiver, which is really just focused on work requirements, the Kentucky Health has a lot of different pieces. It has deductibles, premiums, cost sharing. It eliminates retroactive coverage. It eliminates non-emergency medical transportation. There's lockouts for failing to timely renew or failing to report a change timely. And then there's a work requirement, which is 80 hours a month of employment or community engagement. I think another important difference between the Kentucky waiver and what we're looking at in Ohio is that Kentucky is applying the work requirement across all Medicaid eligibility criteria or categories, so not just to the expansion group. They do have some exemptions, pregnant women, medically frail, but regardless of what general category you fall into, unless you're disabled, you can be subject to those requirements. So this was approved on the 12th. On the 24th, the National Health Law Program, Kentucky Equal Justice Center, and others filed a lawsuit. It was filed in the district court for the District of Columbia. They have 15, I think, individual plaintiffs, and they are requesting that the court certify a class. The defendants are all federal administrators, which was why they were able to file in the District of Columbia, so both individuals from CMS and HHS. I'm only going to talk about the arguments relevant to the work waiver, but there were arguments about how all of the other pieces that I talked about may also violate, whether it's the Administrative Procedures Act or other federal rules. So what InHelp argues in co-counsel is first that the Dear State Medicaid Director letter violates the Administrative Procedures Act. Basically, the Administrative Procedures Act provides that a court may hold unlawful and set aside an agency action if it's arbitrary, capricious, an abuse of discretion, or otherwise not in accordance with law, and that these work and community engagement is categorically outside the scope of the Secretary's 1115 waiver authority. So 1115 has specific areas that can be waived. Work is not included in that, nor is it included anywhere in the Medicaid Act. They also argue that the letter that was issued by CMS should have been subject to notice and comment rulemaking process. So as you heard, it was issued one day, the waiver for Kentucky was approved the next. There was no opportunity for any feedback on the letter, which dramatically changed how CMS looks at work when required for Medicaid. They also argue that the letter relies on factors that Congress had not intended the administration to consider, failed to consider aspects that are crucial, and offered an explanation that was counter to the evidence. The next relevant thing for us that they talked about is just that the work requirements themselves violate the Administrative Procedures Act. They are not experimental pilot or demonstration project, nor are they likely to promote the objectives of the Medicaid Act. And that it was abuse of discretion because the decision to approve Kentucky's waiver ran counter to the evidence that was on the record. There were lots and lots of comments, lots and lots of information in there, most of which was not supportive of this, questioned the data, and yet it was still approved by CMS. The third argument that they made was that by approving this waiver, they were in violation of the Take Care Clause in Article 3, Section 3 of the U.S. Constitution, which is basically that the President has an obligation to faithfully enforce and execute laws passed by Congress, and that this clause is enforceable against presidential action which undermines statutes enacted by Congress and signed into law. And so what they're saying here is that CMS is going beyond the scope of what they are permitted to do, and they're really trying to undercut the Medicaid and expansion rules that were approved by Congress, and they're trying to do an administrative run around that. The current status of that case is that they're awaiting an answer from the defendants. The defendants did file a motion to transfer the action to the United States District Court for the Eastern District of Kentucky, which I'm guessing would not have the same judicial panel that they would have in D.C. And so they've objected to that, and we're waiting for a decision from the court on that as well. So the next slide that's already up there is the possible legal challenges for Ohio's 1115 waiver. We think that many of those are the same as what we saw in the Kentucky case, that there are Administrative Procedure Act or APA challenges that could be brought, both based on the Dear State Medicaid letter itself, and then also the approval of, assuming it's approved, community engagement and work requirements, as well as the Take Care Clause. The other thing that was not included in the Kentucky case, but I think is worth considering in Ohio and will depend on what the final waiver approval looks like, is whether there are claims for the ADA. So what Loren mentioned a little bit about the trying to match this up with the SNAP work requirements. What we have seen within that group of individuals is that there are many individuals who do not meet the definition of disability within Social Security, SSI, or SSDI, but would meet the definition of disability under the ADA. So they have a disabling condition. It may not prevent them from doing any work in the national economy, but it does limit their ability to do certain types of work, to do different types of functions. And these are the types of folks who we've seen who have had a really difficult time meeting the additional administrative barriers for SNAP, and then also getting work placement in a place that's a good fit for them. And so we think that's a place that's worth considering as we go forward with considering what legal theories to bring. The next one is Title VI of the Civil Rights Act. Loren mentioned racial inequities. Again, with the SNAP rollout of work requirements, we saw very clear racial disparities in who ended up being subject to those work requirements and who ended up being exempt. By aligning these two, that inequity will be magnified. We had filed an administrative complaint on that issue with the United States Department of Agriculture, which has not been decided and is still pending. But I think a similar claim may be able to be brought here depending on, again, what the final waiver looks like. The last sort of thing worth considering is the Fair Labor Standards Act. So what we see in other benefits cases where there are work requirements is that agencies do have to consider FLSA, and so they have to consider whether the benefits the individuals are getting at least equal minimum wage for how many hours the person is having to work. There's not any guidance around this within the Medicaid rules because there haven't been work requirements. And so it's sort of an interesting question about how that will be considered. So if someone is only getting Medicaid and has a work requirement, what are we comparing it to? Are we comparing it to the Medicaid managed care capitated rate? And how many hours are considered to meet minimum wage depending on if you meet the rate for that month or don't. So it's sort of an interesting question, but I think it's something we want to at least put on the table to look at since in the other benefit context, it has been clear that this has to be considered in how much an individual can be required to work. If you have individuals or organizations who you think are likely to be affected by these work requirements, I would.
Hi, everybody. So I'm going to talk about how to be heard on this. And I guess before I get started, you can advance to the next slide, please. So I do want to emphasize what I think maybe you've caught from the first two speakers is it is really critical to comment on these, to voice your opinion, your opposition on these, because this is, first of all, likely to be an impact on lots of those individuals who are using Medicaid as their source of health care coverage, whether they are exempt and therefore have to do documentation and work with caseworker and others to show they're exempt, or whether they're not exempt and they have to do these other additional steps. So all of those individuals will be impacted, many both eligible and currently ineligible under those standards can lose health care coverage. But I think it's also the piece that this is a foot in the door in terms of really eroding the coverage that is available for many people that provides health care, that allows them to work, that allows them to be successful in their community. So let me move to the next slide. And probably, so there's really 4 primary places that you should be taking advantage of to make your voice heard on this. And I'm going to talk individually about each one so you can move to the next slide. So first of all, I think you've heard that there is a public hearing on this Thursday, March 1st at 10 a.m. It is part of another usual public meeting called the Medical Care Advisory Committee meeting, but that there will be a hearing as part of that. So you don't have to sign up ahead of time. There'll be an ability to sign up there. Even if you are uncomfortable testifying, come to the hearing, show your support for others that are there. But what I will say is you don't have to, and I'll talk more about kind of things that you can mention, but this doesn't have to be formal. This can simply be about why you think the Medicaid program and work requirements are in opposition to each other, that this is something that shouldn't occur. So you can simply come to state your opposition. You can come to talk about how Medicaid has been important to you or to your community, but it really is important for you to come in and talk. So next slide, please. The other piece is there's the ability to submit public comments. So both the testimony that would happen in hearings and public comments, written comments, are something that the Ohio Department of Medicaid have to consider, and those have to be submitted to the Center for Medicare and Medicaid Services, CMS, when Ohio makes the application. You can email comments to Medicaid. If you do so, we'd love to have a copy of those comments. We find it useful in terms of our advocacy with Medicaid. And we also have a survey that we're using to help to collect comments. So if you don't kind of know how to write or what to do there and you just want some help in getting there, if you go kind of through our survey, it'll help you a little bit to do that. And we will submit all of those as comments to the Ohio Department of Medicaid, so your voice will be heard there. And then if you really want, you can either in person or in mail deliver written comments to Medicaid, and the address is there. Next slide, please. We actually also put, there's a QR code, so if you're sharing this with anybody, if they're used to using that, there's a QR code. We've posted it on Facebook, and we also have it posted on Twitter. So if you're able to reach out to individuals, let them know. We've had this survey out, I want to say 6 days. We have 160 individuals who have commented through that mechanism already. Most of the individuals are not Medicaid individuals who rely on Medicaid. They're people who are concerned about it. But we're certainly encouraging both individuals on Medicaid as part of the expansion and those who are concerned about it to complete the survey and to submit comments that way. We move to next slide, please. So here's when you're providing comments, here's some of the ways you might think about it. First and foremost is tell your story. Whether that's your personal story with Medicaid as your source of health care coverage, whether that is your experience of how Medicaid health care coverage has helped individuals in your family or your community or in your business or otherwise, include those aspects of your story of why personally it is important to you. It's also important to the extent that you can hit on other points, such as your understanding of how people are likely to lose coverage and health will be hurt. So it might be your experience with applying for benefits and how challenging that could be, and the fact that extra burdens will make that much more difficult. It could be that you or people do not fit in any of the exemption groups, but you realize how difficult it will be to meet those work requirements or volunteer requirements because of challenges. Include that. Include the difficulty of documentation, the difficulty of potentially getting documentation from a health professional, or your knowledge on that. One of the individuals who testified at the hearing in Cincinnati talked about some of her clients who have mental illness, but who don't necessarily explicitly recognize that they are struggling with it, and it's difficult enough to get them into treatment, little less getting them, having them willing to say that it impacts on their ability to get employment or otherwise. So those kind of stories, I think, are powerful and meaningful because they show that this work requirement does not promote people of low income getting health care and health care coverage. Let me go to the next slide, please. The other place is media, and these little points on media are also work back to any of the other comments, but we are frequently asked by newspapers, by radio, television to provide individuals that we know of that would be impacted by this, to tell their story, because stories are very powerful motivators for other people and for how they think about things. So if you know of stories, if you have an experience with this, we'd love to have your story and help to work with you so that you could tell it to a reporter. As well, write a letter to the editor. I mean, everybody's got their local paper. It's important whether it's the Columbus Dispatch or Plain Dealer as much as it is your local community paper. Get that out there. Tell how Medicaid keeps you healthy. Tell how it makes it, if people lose Medicaid, it'll make it harder to work. It'll make it harder for people to fight addiction. Tell them why, additional paperwork is just such a problem in terms of people being able to keep their coverage. The next slide, please. And then finally, I think Loren brought this up, or, well, I know I did. This comes from legislation in the budget that was passed that required that the administration do this. So this is the majority House and Senate that made these work requirements part of Ohio law. So if you disagree with these work requirements, you need to let them know. You can find your member of the Ohio legislature at that website. You may actually know their local telephone number. I'd make use of that. Let them know why you think this is problematic, because what they have done, they can undo. And they need to understand what kind of impact this is going to have on the communities that they represent. Next slide, please. You can contact me with any questions. If you have stories, please send them to us and we can work with you on those. Just to be clear, we never provide a reporter with your contact information without first working with you and being clear and having your sign off that you want to talk with a reporter. So just because you're telling us your story, we are not using that story directly with them until you agree. But let us know about stories. Next piece, please. Just to let you know a little bit about the groups that we believe, the individuals that we believe are vulnerable, that maybe slipped through the cracks. So, and therefore will probably struggle with meeting the requirements, but there is no exemption for them. I think, and this is not a complete list. I'm sure there are others, and we'd like to kind of understand those. If you've got examples of those, let me know, or let any other presenters know. So that would be individuals going through reentry, individuals with no minor children at home, individuals who are denied unemployment, or those who work on an intermittent basis or get paid in cash, seasonal work, individuals who are caregivers to a family member who does not live in their home, people who are self-employed, homeless individuals, including youth, former foster kids, and then those with ongoing health care needs for physical or mental health, but that are not on specialized recovery services. So there's a whole groups, whoops, and I think I missed one, people who are previously denied or terminated from SSI or SSDI. So those are the groups that we've identified already that we believe will have difficulty in complying with the work requirements, but that aren't exempt. If there are others, let us know. But if you have relationships with individuals that fall in these groups or this community, then that's a place you need to be speaking out about. Thank you very much, and I'll turn it back to Annie.
So at this time, if anyone has any questions for any of our presenters today during today's webinar, please feel free to ask those right now. We would ask, if you have a question for a specific presenter, to please say which presenter the question is directed to. So we have a question. It isn't directed to anyone in particular, but how are county JFS offices responding to this? Is the Directors Association weighing in? So if any of our presenters have an answer to that, please feel free to weigh in. Loren is going to take this one.
Sure. So I haven't heard anything from the Directors Association quite yet. I imagine that they're still trying to go through the implications of what this proposal means for all of them. I will say that I've heard from individual counties, and many of them are highlighting a lot of the concerns that we discussed. This idea that the Ohio Integrated Eligibility System is still being developed, and as a result, that the smoothness of this data reconciliation, this eligibility reconciliation, is not going to really be in place in time. That number two, that like with the TANF and SNAP work requirements, they don't even have all the resources available to case manage these folks into work placements, even if they wanted to, and that they have additional considerations around cost, meaning while many things may be able to be handled administratively, in terms of the data or what have you, that they still predict a lot of folks to require some level of case management on the phone or in person. That means staff time, that means extra cost into that staff time, training, etc. There's also been some questions around access to that data. Many counties, I think, don't have the ability to parse out the data that exists in all the different benefit systems, and so they are relying on the state to provide that to them. So there are still lingering questions as to whether or not that information will be handed to them, or if they are responsible for working through it.
The hearing actually will also have, that is on the 1st, on this Thursday, will also have the ability for you to view it through a webinar, but you will not be able to testify through the webinar. So
there's one other question, again, not directed to anyone in particular. What is the dynamic in Washington that led to this? How likely are they to adjust after being sued is the question. If any of our presenters want to tackle that question.
Well, I think the first question is the first part of that is a pretty big question. But certainly, there are efforts by certain groups of people to really change the existing safety net. And certainly we've seen pushes for work requirements and time limits in the past. The idea that people are getting a free ride does not sit well some places, and I think that's how it's viewed. The second question is the second part of that is interesting. So one of the things that I talked with NHELP about at the end of last week was we had expected to see a number of the other states' waivers approved more quickly than they have been. And I think there's a number of different factors that play in there. Every waiver is a little different. Every waiver has, sort of its own issues that they have to work through. But it has been a little slower. I think there were at least some predictions that as soon as that Dear State Medicaid letter came out, that just like Kentucky was the next day, that then, every consecutive day after that we would see another one. And we haven't seen that. I don't know if that is in a response to litigation. I think they were probably pretty aware that they were going to be sued before that. But it has been slower rolling out than we had expected.
Okay. Give just another minute or two in case anyone else has any questions for any of our presenters. Again, we will find a way to make those slides available to anyone who wants to access them. Okay. And seeing no more questions for our presenters, I do want to thank everyone for attending today's webinar. And like I said, we will make the slides available, and each of our presenters are available to answer questions privately. They all included all of their contact information on these slides, and I'm sure that they would all be happy to field any questions that you may have.